So let's see the orbit anatomy quiz and the explanation. So let's go and start this quiz. Okay, so I'm ready to give the quiz. Let's see the first question. The first question is regarding the development of the orbit bones. Now, if you have attended the first quiz, you could have answered this question from the explanation that all of the following structures derived from surface ectoderm or SLE, from neuroectoderm, optic up is ROMES, and mesoderm MES. So rest everything taken as an exception. So this orbit bone does not come in any of the three. So it is an exception. Answer is neural crest. I hope you have got this question correct if you have given the first quiz on embryology. Now, which of the following is the greater wing of sphenoid? This is the right orbit, in which the A bone is a lateral wall, that is zygomatic bone. The B is in the floor, that is maxilla. The answer is D, that is greater wing of sphenoid. And C is the roof, is in the roof, that is a frontal bone. Now, SOF is a fissure. If you can see between the greater wing and lesser wing, there is a gap. That gap is known as superior orbital fissure, through which various structures pass. So it is between the two wings of sphenoid. It has upper part, middle part and lower part. The floor of the orbit, as you can remember, as PA, ZA, MA, plasma, palatine, maxillary and zygomatic. Which is not involved is a sphenoid bone. Now, from which part of sphenoid is not a part of orbit? Greater wing is in the lateral wall, lesser wing in the roof and body in the medial wall. So pterygoid process is not a part of the orbit. So as I was telling, there were three parts of SOF, which is divided by annulus of Zinn into upper, also known as lateral, middle and lower. Upper part you can remember as LFT, lacrimal frontal trochlear nerve and superior ophthalmic vein. Middle part NOA, nasociliary oculomotor upper and lower division and abducens. Here the answer is abducens, which is passing through the middle part, and lower part is the inferior ophthalmic vein. This is the right orbit. The marked is optic canal, that is optic foramen. Optic nerve passes through it, ophthalmic artery comes inside, and sympathetic fibers also pass. So A is true. It is present in lesser wing, in the roof, yes, true. It is in the apex, yes, all the fissures are there in the apex. Apex is posterior part. And radiology question. You should know the ABC from ophthal, and from radiology you should know the RHESS, RHESSE view is for the optic foramen. Waters view is the answer here. Waters view is for the maxillary sinus. And orbits are bony structures of the skull that houses everything: eyeball, extraocular muscles, fat, lacrimal apparatus. But cavernous sinus is retro orbital structure. It is behind the apex of the orbit, that is D. That's the questions. I hope you have done correctly. Best wishes from my side.